We can't measure when you go into perimenopause. We have to use your subjective reports of symptoms, but we can measure when you are in menopause with FSH and anti-Mullerian hormone. Now, an anti-Mullerian hormone may be the missing ingredient to heart-healthy cholesterol levels for menopausal women. And this is interesting because the North American Menopause Society will not come out and say hormone replacement therapy should be given to all women to be protective for your heart health. They know it helps your heart, but they don't think it's end all be all, and they don't understand why. And this is talking about the anti-Mullerian hormone could be the reason the estrogen isn't everything this is. So here we go. Step aside estrogen. Scientists at the University of Pittsburgh have discovered a predictor of blood, lipid, or cholesterol status for midlife women that may be key to understanding how hormone replacement therapy contributes to heart health. In a study published this week in the Journal of Clinical Lipidology, Dr. Samir R. El Kharidi, I just killed that, have identified a link between the lesser-known hormone called anti-Mullerian hormone, AMH, and lipid or cholesterol levels in midlife women. With this information and in combination with what is known about estrogen, clinicians may get a better picture of cardiovascular risk for women entering menopause. Estrogen is not the only story. So we are now getting more information about other markers that could play an important role and could more precisely and consistently tell women where they are in relationship to their menopause transition. Throughout that period before, during, and after menopause, also known as the menopause transition, midlife women are at a heightened risk for cardiovascular disease, which changes their lipid levels, such as a sharp increase in LDL or bad cholesterol. Hey, welcome, because that's what's happened to me. And when I found out my cholesterol was because my hormones, my mind was blown. And the only reason I found out about it is I'm writing a book about the science of wellness and women's health, and I was blown away. I'm also studying for the North American Menopause Society practitioner exam, not to write hormones, so that I could spew information to women nonstop so I can educate y'all. So I'm taking one for the team right now. Carrying on in our article, scientists previously determined that this increased risk of heart cardiovascular disease may be partially due to a decrease in estrogen levels. However, estrogen replacement therapy has not had the massive cardioprotective effects that doctors were hoping for. We know it helps, but it's not the end-all be-all, so there's something else. Thus, scientists have been on the search for other factors that might be affecting cholesterol. Welcome, AMH, to the party. It is a hormone that is most well studied as an important factor for determining the gender of a fetus in utero. Recently, however, AMH was found to have a strong and reliable connection to the timing of the menopause transition, and new technology is making it increasingly easy and cost-effective to monitor. AMH can be used to measure how long your ovaries can keep producing eggs. The more eggs that are there, the higher the AMH. The fewer eggs, the lower level of AMH. And when the levels become very low, we can use it to predict menopause. So AMH is something to watch for. And if you wonder if you're in perimenopause, menopause, where are you? You can have your FSH and your AMH checked in your blood work.